The randomized evaluation of the Nicaraguan Social Security Institute's voluntary health insurance is exploring alternatives for the extension of Social Security health coverage. Independent workers in Managua from 7 commercial markets had the opportunity to participate in our study, to register for INSS's voluntary insurance, and to share with us some of their preliminary impressions from their experience with this health insurance. The evaluation is financed by USAID's PSP-One project and by the Global Development Network. We visited some of the participants in the survey who had won free insurance to talk to them about their experiences with the insurance. Male respondents did not want to be videotaped, but some of the female participants agreed, only 2 to 4 months after receiving a winning lottery ticket from the project. Many women had already begun to use insurance services and visit clinic. This ticket gave them access for either 2 or 6 months of free insurance. You will hear that some respondents had a positive experience with the services they received.
In Cruz Azul, they attended me well. They were very nice. They were very nice. Yes, I went to a specialist and a general doctor. It is a benefit. If I feel bad, I will keep going. The price is not bad. If we have the money for it, we should pay for it. Good afternoon. My name is Argentina Espinosa. My experience with the health insurance was very important. I received a benefit. They came to visit my booth and asked if I would participate in an interview. I said yes. I won a prize. I work with ProCredit. They arranged for everything. I signed up at Médicos Unidos. They have given me good attention, and thank God I received a benefit because I don't have very good health. I have always had to spend a lot of money to improve my health. In this period that I have had the benefit, I have been able to save money. Everything has gone well with the service until now. ProCredit has also helped my business to grow. I also want to say that I will keep paying for the insurance. In the clinic Médicos Unidos, they have treated me very well, and I'm willing to continue paying.
Estoy dispuesta a seguirlo pagando.
The 2 times I have been there, I was seen by a doctor. They opened a file for me, and the women who received me were very nice. I received medication at their pharmacy. There are things that this does not cover, like maybe some surgeries. It does cover maternity, but not some other things. At my age, I am 52 years old, almost 53, I need urgently to check myself. Because there are many kinds of cancer, stomach cancer, colon cancer, breast cancer, and all that. I don't want to be like those people who have cancer. It depresses me. I would be willing to keep paying. But as I said to the surveyor, if I receive good attention with kindness, I understand that this is their job. However, one always needs kindness. In fact, the doctor said, I will give you a prescription. This is covered by the insurance, and he did give me all of the medicines. I felt very good, and I think I will continue to feel good. So I said yes. After this, I think I will continue with this service. I began to work with ProCredito, and I was benefited with a voluntary insurance from the INSS that I am currently using. I received a voucher for free insurance through a survey they did here at the market. Afterwards, they gave me the affiliation documents. I had to bring a copy of my ID card and my children's birth certificates. Then, I waited 1 month to receive my receipt. That's how I was able to go to my medical visit, which is necessary for us, independent workers, in order to take care of ourselves and our family's well-being. I have attended various medical visits, through which I have received help. Maybe not 100% like one needs, but it does help us find solutions to many of the needs we have. And I have noticed that my health has improved. So far, all the doctors that have seen me are very good. However, there is a long waiting time to have a medical visit. I leave at 8 in the morning and I am not back until 3 in the afternoon. This means losing a day of work. In case of an emergency, I have a safe place to go and see a doctor. I am currently paying for the insurance myself because I liked it. I went once for a medical visit at the El Redentor clinic. I haven't been able to go again because of time. I hadn't been able to go see any doctor before because I didn't have money for that. We didn't have the money to go and buy expensive medicines. So thank God they gave us this help. Doctors come to us at the market only once a year, but I hadn't had any checkups with them either. I have 2 young children, and I would like for them to get better medical attention. When I used to take them to the public health center, I had to pay for medicines. So I was very interested in this, and that's why I agreed to participate. Thank God I received the benefit, and I liked it, although I know that in the future we have to pay. But that is our decision. Yesterday, I received very bad attention. I had a contract with El Redentor, but I went there and they did not see me. They said my contract didn't exist. My child was sick, and when I got there, they said they could not see me. In fact, I was a little disappointed, but I know that this mistake will be resolved. For me, I think my children will get the benefits, because they are young now. I am interested in continuing, and after 6 months that I received the benefit, I would like to continue paying. They told me that after I got my receipt in August, I could see the doctors in September.
Other women that we visited explained that they had a negative experience with health services through the INSS insurance. These women had signed up specifically with 2 of the 17 available clinics in Managua. The program allows for people to select their clinic freely and switch if they are not satisfied with their services. The researchers found that these 2 clinics were aggressively marketing to this sector and were conveniently located near the markets. However, once patients arrived at the clinics, reception personnel often rejected them because the clinic salespeople had not carefully explained that there is a 1-month waiting period when switching clinics. They were sent home to wait. In some cases, micro-entrepreneurs did receive service but had long waiting times that may have been similar to the waiting times in public facilities. Additionally, one woman with a pre-existing condition was rejected without explanation.
Because we aren't paying, they don't see us with love. I have not been to any clinic in all of my life. I have not seen a doctor in all my life. If God gave me this prize, it is because it is mine. So I said, I will take this opportunity, and I will go and get a checkup. But I have never had a checkup. I have never gone to a doctor before this, because I am healthy. I needed them to see me because I was very sick. And I was so disappointed when they told me that they canceled my insurance. The first time I went there, the attention was not so bad. The second time, I went and they gave me an appointment at 1 p.m. And I waited 3 hours and asked the young lady how long I had to wait. They didn't see me until 3:30 or 4 p.m. I want to change to a different clinic that will give me a better attention. The service is somewhat deficient. I have even wanted to change clinics to see if another clinic will give me better service. My biggest problem has been that I was visiting a cardiologist because I have heart problem. Otherwise, I do not get sick. They gave me some papers and told me that I could continue to pay it through the bank, which is Procrédito. They told me that I could continue to pay 270 Cordobas, about $14 a month, which is something that I can afford. Because you know, the way the situation is in the country, we don't have the ability to pay for a private clinic. And we are grateful for the effort that you are making and for the support that you are giving to Nicaraguans.